Bismillahirrahmanirrahim. I am Dr. Mukhshid Ahmad Bangash, Dietitian Pharmacist TB Control Program, presenting the SLDs Demand Sheet TB 12. Here we will discuss how to quantify and forecast the second line drugs for DR-TB patients registered. So this is the adjusted morbidity method. In past, we were adopting the consumption method, that we were quantifying the drug on the basis of the previous consumption in the previous quarter. So it is observed that by adopting the consumption method for forecasting the drug, despite of adding the 33% buffer stock, we were not able to avoid the stockouts, and the treatment of the patient was interrupted. Hence, the outcome of the treatment will also be suffered. So we decided to convert this demand and supply method by quantifying the drug through adjusted morbidity method. This is actually the morbidity method based on the cases. And after the quantification, we will adjust it according to the previous consumption trend or pattern. So let's go to start the presentation with dosage chart. We will try to understand that how many type of regimens are adopted in the treatment of DR-TB patients. Let's see that here are five type of DR-TB regimens. First one is the LTR, long treatment regimen 1, which is comprised of 18 months or 72 weeks. It should be noted that all type of treatments of DR-TB patients are comprised of three phases. Phase 1 comprised of 2 weeks, phase 2 comprised of 22 weeks. These two phases, phase 1 and phase 2, combinedly they make 24 weeks or 6 months. And phase 3 varies from regimen to regimen. In long treatment regimen, it is 48 weeks, means 12 months. And in short treatment regimen, it will be 20 weeks or 5 months. In BPaL, the phase 1 will be 2 weeks, phase 2 will be 22 weeks, and the phase 3 will be the 12 weeks, means 4 months. So it will be the, well, it's 3 months and it will be the 9-month treatment. BPaLM will be 6 months treatment, comprised of phase 1 2 weeks and phase 2 22 weeks. And there will be no time for phase 3. No phase 3 is there for BPaLM. So BPaLM comprised of 24 weeks or 6 months. Let's take them one by one. LTR 1 is described above, that this is 18 months treatment, and in this for 6 months we give the levofloxacin plus bedaquiline plus linezolid plus clofazimine plus cycloserine and pyrazinamide. There is other 12 months of treatment. We contain only levofloxacin, clofazimine, cycloserine and pyrazinamide. It means that we don't use the bedaquiline and linezolid in the 12 months, next 12 months of the treatment while treating the patient through LTR1. Let's go and see that how these 6 drugs are used in this patient under the treatment through LTR1. So the drugs are bedaquiline 100 milligram tablets that will be used uh, 4 tablets a day for 7 days during first phase, that means 2 weeks. During next 22 weeks or phase 2, it will be 2 tablets per day and for 3 times a week. And during the phase 3, there will be no use of bedaquiline at all. Similarly, linezolid, this will be the 1 tablet daily for 7 days a week. In during the first phase, that is first 2 weeks, and after that 1 tablet per day for 7 days a week. And during the phase 3, there will be no use of linezolid, same as like bedaquiline. Levofloxacin will be given as 4 tablets daily for 7 days a week during first phase, that is 2 weeks, and then 4 days of per day, 4 tablets per day for 7 days a week, and for next 22 weeks. And then during phase 3, it will be again 4 tablets per day for 7 days a week. So the levofloxacin 250 milligram will be used as same as from first day to the last day of the treatment through and through. Clofazamine similarly will be used 1 tablet daily for 7 days a week during the first phase of the treatment, that is 2 weeks, and then again 1 tablet daily for 7 days a week for next 22 weeks, that is phase 2, and then again 1 tablet daily for 7 days a week for next 48 weeks. So throughout the treatment of LTR1 patient, the clofazamine will be used uh, from the first day up to the last day is 1 tablet a day, 7 days a week, till 18 months or 72 weeks. So cyclosine is similarly that is used for 2 tablets daily, 7 days a week during first 2 weeks, that is for phase 1, then 2 tablets daily for 7 days a week for next 22 weeks, means phase 2, and then again 2 tablets daily for 7 days a week for next 48 weeks, that is phase 3. Similarly, pyrazinamide will be given 4 tablets per day for 7 days a week during first phase, that is 2 weeks, and then again 4 tablets per day for 7 days a week for next 22 weeks, and then again similarly in the same way 4 tablets a day for 7 days a week for 48 next weeks. From first day up to the last day of the treatment, the tablets pyrazinamide will be given 4 tablets per day for 7 days a week for all of the 72 weeks or 18 months. So this was all about the LTR treatment. For LTR2, we will go for next video. Thank you.